Hello, I am Brenda Caudle, DNP student at Eastern Kentucky University. Welcome to my discussion, Leadership and Change Theory, a framework for intervention at a university health center. Human papillomavirus, or HPV, has quickly become the most prevalent sexually transmitted infection, especially among traditional college students. Despite the availability of a safe and effective vaccine, vaccination rates remain low among both men and women. University health centers have the potential to significantly influence students' vaccine acceptance, given their unique setting and patient population. The nurse leader utilizes Kurt Lewin's change theory as a framework for developing an educational intervention intended to increase HPV vaccination rates. His theory consists of 3 stages: unfreezing, moving, and refreezing. In the unfreezing stage, the leader motivates staff with facts regarding HPV, including the low vaccination rates and possible health consequences. In Lewin's moving stage, the nurse leader collaborates with the University Health Center staff, specifically soliciting ideas from those at the front lines of care regarding the content, style, and delivery of the intervention. This particular health center employs 3 nurse practitioners, 2 registered nurses, 3 medical assistants, and 1 receptionist. Once plans are developed and finalized, 1 RN and 2 medical assistants pilot the intervention to select students, with student opinion guiding any necessary revisions. The nurse leader realizes the variations in staff interests and strengths, some stronger in communication skills, and some with technical expertise. The nurse leader allows staff to choose their individual involvement in the new intervention. The final stage, refreezing, occurs when the intervention becomes mainstream, a sustained educational procedure for HPV vaccine acceptance. To determine the effectiveness of the new educational intervention, staff would calculate HPV vaccination rates at intervals of 3, 6, and 12 months post-intervention. Nurse leaders recognize the benefit of utilizing a leadership framework in addition to a change theory for successful development and implementation of an intervention. Cantor's theory of structural empowerment is a business-based model which suggests 4 factors within the work environment that affect staff performance. These include having access to necessary resources, having access to needed information or education, support from leadership, and being allowed the opportunity for professional growth and development. Effective nurse leaders carefully consider how to ensure the work environment is conducive to optimal staff performance by aligning Cantor's structural empowerment theory with Lewin's change model. Within the unfreezing stage, the nurse leader provides staff with knowledge and resources necessary to begin developing the new intervention. HPV facts are shared. Instructional technology support is offered. In the moving stage, the leader continues to offer support to University Health Center staff, possibly offering professional development time away from regular clinic duties to complete the intervention. Finally, to facilitate refreezing, the leader must continue to encourage staff commitment and motivation to sustain the educational intervention. It is hopeful that as staff realize their significant contribution to increasing HPV vaccination rates within their student population, they will be empowered to remain dedicated to the positive health of their students. Thank you.